hopefully you've all managed to have some lunch. I got to chair a meeting of the RCR over lunch, which was exciting. So I'm delighted to invite Catherine Borysiewicz, who's a consultant dermatologist, who's going to talk to us about skin care for patients. And I think we talked in the morning about some of the side effects of Optune. So half of all patients with Optune get skin side effects. And, you know, my knowledge of skin care is limited. And so having someone like Catherine to be able to refer to when my standard advice, which is have you tried steroid cream, doesn't work, is immensely useful. So Catherine, please, I'm going to ask you to introduce yourself briefly and then start talking. Catherine, I'll do your slides for you remotely. So if you just say next slide whenever you're ready.
Brilliant. Well, thank you so much for having me back. It's lovely to be here again, chatting to you all. If I can have the next slide and the next one, because I think that was my heading. Lovely. So who am I? So I'm a consultant dermatologist. I've known the lovely Matt Williams for many, many years, working with him at Charing Cross and Hammersmith. I don't think he's being very fair saying that all he does is put a bit of steroid cream on and then fails. I think that over the years, you've learned loads of dermatology. So I'd say you're pretty spot on at managing a lot of this. But you're quite right that when I first started getting involved in trying to help patients who were using the Optune device, we realized that probably the skin side effects were the most troublesome. So it was really trying to put some of the things that I know about dermatology and skin and trying to help patients tolerate the Optune device for longer periods of time to allow them to have efficient treatment. So I used to work in the NHS. I'm now just privately based. And it's interesting because since doing private practice, you suddenly have more time to get involved in all of these exciting things and giving lectures and trying to kind of put your thinking hat on to solve through problems. So I have actually been able to move things forward from when I was last talking to you all, and I've come up with some special ideas about compounding specific prescriptions for patients who are using Optune, but I'll touch on that at the end. So if I can have the next slide, please. So you all know about the Optune device, and what I really want to kind of run through are some of the specific challenges that the skin faces when you have to wear the Optune device, and what it is about the skin structure that's kind of being irritated or inflamed. And then we've got to be super practical. So what are the really simple things that everyone can do to help keep the skin in as brilliant a condition to try to avoid any side effects, first of all, so kind of preventative care. But then also when things do go wrong, what can we reach for and what things tend to be the most helpful? And I think probably the most helpful bit of the talk last year was just having plenty of time at the end for people to ask questions. So if I could have the next slide, please. So from my experience of looking after the few patients that have come my way with really difficult scalp problems with Optune, I've tried to sort of summarize in a nutshell what I think the different issues are. So one of the first problems that we're seeing is that after surgery, we've got kind of lumps and bumps and dips and crevices on the scalp, which can cause their own problems and can also lead to specific challenges with trying to apply adhesives. And you may have specific areas such as little bony ridges and things like that, which are causing a lot of discomfort, and then you end up with pressure effects on those areas. So that's certainly one element of what we're seeing. Now, the second element that I think is probably key is the need to use an adhesive material. Now, in dermatology research, so if we wanted to take someone's skin that was normal and healthy, and we wanted to basically induce an eczema type reaction in their skin, one of the techniques that we use in the lab is something called tape stripping. So basically what we do on that normal skin, we put a piece of tape and then we strip it off. And what that stripping effect on the skin does, it kind of wakes up the immune system. And then you end up with an eczema type reaction occurring underneath it. So I think probably one of the key things around the Optune device, it's not necessarily any of the particular equipment or materials or even the type of sticky plasters. I think sometimes one of the major issues is the actual stripping effect, with the need to kind of remove and reapply and then getting the kind of eczema that brews underneath those areas that have been inflamed. So one of the other issues that we've got, so normally in dermatology, if I have a patch of eczema or itchy skin, we tell people to put plenty of moisturizers on, lots of greasy treatment creams, and then the skin gets better. But in this situation, we can't really do that, because the key is that we need to have this device next to the skin with really good adhesion. And we can't do that through kind of grease, because everything just slips off. So if I try to get patients to do my usual eczema management, basically the device would just slide off your head. So we've got to come up with novel solutions, trying to look at different textures of products to see what works best. And finally, the other thing, which I think I'm sure you've spoken about already today in other sort of forums of the discussion, it's about the actual device itself, places that can sometimes be particularly vulnerable about generating pressure on the skin. And often that's where you've got the cabling, or where you're needing to sort of stick down different sort of slightly bent wires and things next to the skin. So that in itself can cause pressure sites to occur. And then if you've got the added kind of tape stripping going on, you then develop little sores on the skin, and those sores can then become secondarily infected. So that can kind of create its own issues. Next slide, please. So with the skin, we always think about the skin as a sort of waterproof layer. But as a dermatologist, I like to think about different bits of the skin that are kind of key players. And really our understanding about the importance of the different structural components of the skin, and also the kind of active skin immune system, is really what's driving some of the really exciting new treatments in dermatology, in many, many fields of dermatology. But one of the things that you have to remember is that the skin is not just a straightforward waterproof layer. It's also got a really nice microbiome, which is this kind of big sort of collective cuddle of microbes, bacteria, yeast, viruses that sit on the surface of our skin. And that can have a very calming effect on our immune system. So when it's happy and balanced, it's sending good, happy messages to our immune system. But when that starts to go awry, or when you're having tape stripping and other things happening, you get an activation of your skin immune system. And this is where things start to go wrong. Can I have the next slide, please? So no lecture in dermatology is ever considered complete to a dermatologist unless I've got one of these pictures, which shows a little cross-section through the skin. So certainly when I first started studying dermatology, my background was in immunology, but really the understanding of the skin immune system, it wasn't huge all those years ago when I first started. So really we focused on the kind of skin and its structures. So that's on the right-hand side of the slide. So if you think about the scalp, we're dealing with particularly challenging areas, because we've also got hair-bearing skin. We've got lots of sort of oil production on the surface of the scalp as well. So these are very oily areas. And you can see here that we knew that within that skin barrier, we've also got some active immune cells. But if we move across, oh, sorry, to the right of the screen, so it was on the left before. So if we move across to the right of the screen now, you can see that there's a constant discussion that goes on between things that are happening on the surface of the skin in terms of the microbiome, in terms of feedback loops, sort of constantly, with the immune system constantly assessing what's going on and getting messages back saying, is it good or bad? Or, do we need to get active and start producing a reaction? Is there something terrible happening, like a skin infection or a problem like that? And what we're really focusing on with a lot of the treatment approaches that we're trying to do, managing the scalp with Optune, is to remember that we've always got to be incredibly respectful to this kind of immune system conversation with the microbiome on the skin. And we've got to remember that we keep everything nice and quiet and happy. So we don't want to be sending sort of angry, stressed messages through to that immune system, making the situation worse. So can I have the next slide, please? So where do we start with all of this? Now, every dermatology approach to managing any dermatological condition starts with a really, really simple algorithm. So the first thing we want to do is to remember that the skin barrier is very disrupted when we're seeing unhappy skin. And what we need to do is to make sure that we're cleansing in a respectful way. So that means that we want to use products which aren't typical soaps. So not things which are going to strip all the natural oils from the skin and have perhaps a pH which is too acidic or too alkaline to make the skin unhappy. And what we need to do is to pick a product which has a kind of very gentle formulation, so that we're trying to keep the status quo and not make dry, unhappy skin. We then want to moisturize the skin. So where we're able, we want to use light products so that we can try to act a little bit like a temporary cement. to support those skin cells that are kind of forming the brick wall, which is the sort of protection layer of the skin. And when the skin's disordered, you need more of that moisturizer to help act like that temporary cement to kind of keep everything as smooth as possible and stop any more allergens getting through the skin barrier. And then when things become very active, and when those first two sort of approaches of being respectful and moisturizing aren't working, we will need to have localized treatments that we're able to start, which are of appropriate strength. So we're not using things which would be too damaging to the skin, and also that we're able to kind of choose what we need for the right problem. So it might be that we need to treat an eczema, it might be that we need to treat a sore, or it might be that we've got problems with itching and reactive skin, and perhaps that's being driven by a yeast on the surface of the skin. So we've got to kind of figure out what the problem areas are and then get the treatment moving forward. Now, in the past, we've always had a very reactionary way of managing this. And it's the same, I think, for all patients who are going through any kind of oncology treatment. So kind of, we know that a lot of patients having oncology treatments with radiotherapy, with chemotherapy, will experience lots and lots of skin toxicities. And in the past, we've always very much focused on, well, when things are bad, we'll treat it. But what we're starting to really understand is that preventative, kind of proactive treatment with appropriate cleansers and moisturizers can help the skin be much more resilient and not run into problems later on. So it makes you better able to tolerate the treatments. So if I can move on to the next slide. So this is a study. Now, I always feel very embarrassing whenever I have to start talking about skin research to an audience of oncologists. But I promise in dermatology, we really are trying to address this sort of proactive approach to skincare. So this was Eskimo, there's now Eskimo 2. So there's definitely a lot of work going on about really trying to focus on preventative care. Initially, the studies were very, very small, but we are starting to have larger numbers of studies coming through looking at how important it is to get those simple steps right and the kind of products that you can sort of use to help patients with this. Now, one of the companies that's done a lot of work in this, I guess the way to think about some of these skincare companies and cosmetic brands, it's a little bit like working with the pharma industry in oncology. So we have our kind of a lot of the people that we're working with, there's a huge amount of research that goes into these products and product developments in even products that you'd buy over the counter or in Boots. And they've had some really, really sort of good treatments that have come out as a result of that. So if I can move on to the next slide. So where do we start? What is an appropriate cleanser? Now, the term that we often use to talk about different washes or cleansers are Syndets, and what that stands for, it's a synthetic detergent. Now, there are some synthetic detergents which are really widely available, kind of, you can find them in the supermarket, and I've put one of my favorites up there, which is Sanex. So Sanex do a whole range of products. They are respectful to the skin pH, respectful to the microbiome, and a lot of them are not fragranced as well if you go for the hypoallergenic ones. But one of the other things about Sanex and a lot of the other products I talk about, they do make bubbles, because I think it's something, particularly when you're removing the Optune device from the scalp, you've often got a lot of scale. There's quite a lot of sort of stuff on the skin that it feels really nice to kind of get off with some bubbles, so that you're using the appropriate product, but you're actually managing to kind of use the bubbles to lift away some of the oils as well. For people with very, very dry skin, you might want to go for more of a lotion-based cleanser. Some of the slightly more creamy ones would be a Dove. So Dove is also a soap substitute, but it is fragranced. So again, if you've had problems with fragrances in the past, it might be worth avoiding Dove, but Dove will also do the same job as Sanex, and it's very hydrating, so it contains a lot of moisturizing products. Now, sometimes when the skin is very weepy or has a lot of those little sort of holes or erosions in the surface of the skin, I'll often tell people that we need to use a product which kind of kills off bacteria. So it has some good antiseptic type products in it. And one of the ones that we tend to reach for in dermatology for patients with bad infected eczema or with the Optune device is Dermal 500. Now, Dermal 500 lotion doesn't make bubbles, so it's literally just a lotion that you smooth on the skin. And the way that you would do this, you'd take a couple of pumps of that lotion, you'd smooth it onto the scalp, let it sit for about 5 minutes just to sort of lift any dry skin or scale, and then you get the shower head on and you let it do all the work to kind of remove the debris from the scalp. And it's very important that you do rinse this from the skin. So on the packet, it'll often say that you can use it as a moisturizer as well. I wouldn't advise that because it does contain some chlorhexidine. Now, chlorhexidine is brilliant at killing off kind of bugs and bacteria, but on the skin, if it's left there, it can sometimes be a little bit irritating. And when you've already got sore scalp, the last thing you want to do is to kind of have another irritating factor. And then if you need to apply pads and things on top of that, you'd worry that you'd absorb a little bit more of the product into the pad, and then it would kind of have a bit too much contact with the skin. So just make sure that it's rinsed very, very thoroughly. Now, the whole kind of idea of microbiome has kind of been growing over the years. I remember initially when you started talking about it, people would look at you like you were crazy, and now everyone's talking about microbiome, whether it's your skin or whether it's your gut health or anything. But some of the products that say that they are microbiome supporters, so the way that someone like Dove or Sanex would talk about that, it means that the product itself has an appropriate pH. So it means that it doesn't disrupt the skin barrier, and that's how they view themselves as being microbiome friendly. The other way that products do it is a little bit like the French pharmacy brand products. So that would be La Roche-Posay, Avène, Bioderma, these kind of products that pharmacists will often point you towards if you're experiencing eczema. So these products have mineral water in them. So this is their kind of, sneaky little prebiotic that they're using to try to promote healthy microbiome growth. So mineral waters are often very rich in minerals, obviously with the name, and it means that you're able to use that nice healthy mineral water and sometimes healthy bacteria within those waters to help support healthy microbiome organism growth on the skin. So we don't really talk about sort of, I guess, like gut probiotics as such. So we don't have products available yet, which would be a bacterial colony that you would put on the surface of the skin. So we don't really have a Yakult equivalent for the skin. And that's because a lot of the skincare products, they don't live in the fridge. They live on your bathroom shelf. And they, if we had organisms like that in them, it would just turn to a really manky sort of, stinky growth. So what we need to do is to have products that are able to kind of survive and be preserved. And that way they tend to use this term called a prebiotic. And that's where the mineral waters come into it, talking about, trying to facilitate healthy growth and give the good food for the bacteria. So just for you to kind of understand, yeah, just for you to understand some of those sort of terms that you'll see on a lot of the products. So if we can move on to the next slide. Now, some of the simple things are also just to avoid irritants. So I know that a lot of patients will often use some kind of toner or an alcohol-based sort of spray on the scalp to try to maintain a good adhesion on the scalp. But I think if you're having problems with your skin and if you're experiencing skin breakdown, what you don't want to do is to use too many drying products or products that could potentially be irritating. So we normally say to people, just be careful with some of the ingredients in products. Make sure that they're also fragrance-free if you've got sensitive skin. So just kind of avoid things that don't really need to be in the products that you're using. And then the other thing that we talked about a little bit before was about texture. And I think this is really key because I know that the first few lovely patients that I saw who were having issues with the Optune device, it's really been trial and error with them about me saying, was it too greasy? Was that okay? Can we add something else in or should we try something a bit lighter? And I think over the years, we've tried to kind of move towards lotions, gels, sprays. So those are generally the kind of bits that tend to have more water in them than grease, so that you're able to get the lightest possible product. But having said that, anywhere that you've put a moisturizing product or a treatment cream, you can have challenges trying to get any adhesion. So sometimes you really need to kind of, if you've got an area that really needs to be treated intensively, you've got to rotate the device around slightly so that you're not needing to put the adhesive in those areas and the skin can recover before you then go back to using it. Right, and then we've had a load of stuff already about microbiome, so I'm kind of done with microbiome now. So let's move on to the next slide. So one of the things that Matt mentioned was about using steroid cream. So one of the sort of first products that we've got to try to help when you're having a flare or a nasty dermatitis or eczema on the skin, and we use the terms dermatitis and eczema interchangeably. So when you have this kind of scaly flare, we often need to reach for some form of steroid initially to get things under control. Now, one of the things that we've got happening with the scalp, as I mentioned before, this is a particularly oily area of the skin. So if you take normal scalp and if you take a series of swabs from the scalp, you'll tend to find that these areas are very, very rich in yeast. And it causes problems in the skin, even in patients who are not needing to use an Optune device. And one of the most common things that we see is a form of scalp eczema called a seborrheic dermatitis. And basically, this is cradle cap in babies, but in adults, you get this kind of scaly, crusty, sometimes it will be a sort of yellowy crust eczema on the scalp. And it tends to sort of have a slightly greasy sort of yellow crust. And it's really important that as well as using steroids to try to sort of clear this up, we also need to use some form of anti-yeast treatment to try to remove the cause of the problem. So if you like, we've got the yeast sitting there, it's got a little bit too big for its boots, so there's a bit too much yeast hanging around, your immune system's already primed and kind of not really liking it, and then we've got the Optune device going on top with a load of tape stripping, and it's enough just to kind of act like petrol with that reaction. And it kind of triggers this very angry dermatitis that can sometimes even form blisters and sort of pustules on the scalp. So it can be really, really sore and uncomfortable. So in that situation, one of the treatments that we reach for, good old combination creams from dermatology. So we use a lot of Dactacort, which is a kind of mild spectrum. So it's got a hydrocortisone strength steroid and an antifungal. And then one of my personal favorites, Lotriderm. So Lotriderm has betnovate in it, which is a medium potency steroid, and it's also got an antifungal. And that really works very well, particularly if you're only able to use kind of intermittent applications with the way that you're using the Optune device. So once you've got the treatment cream in, it's got a really good chance to work, and it's strong enough to kind of work and not need to be reapplied that regularly. The other things that we've got in terms of anti-inflammatory creams that are not steroids, so there will come a time where we don't want to be reaching for steroids all the time because we don't want to cause problems with thinning in the skin. So we do have newer treatments called topical immunomodulators. So basically, it's kind of like a hydrocortisone equivalent called Elidel cream. Now, this doesn't have any steroid in it at all, and you can use it once a night or when you're changing the device just to settle down mild areas of eczema, and that will help keep things calm. Now we've got stronger versions of Elidel, but the issue that I've always found with those is that this is something called Protopic, and it only comes in an ointment base on NHS prescription. So that makes it just a real challenge because it's like Vaseline, everything slips off the skin. You can't really safely apply the device on top of something so greasy. It's just kind of, it wouldn't work. Now, we talked a little bit as well about areas of broken skin and secondary infections. So if you've got sores on the skin, the first thing to say is that it's really important to use some kind of preventative treatment. So you want to sort of lift the bacteria away from the skin so that you don't have problems with the bacteria kind of setting up, and getting really stuck into those little sore areas, causing an infection in the skin or a cellulitis. So the ones that we tend to use would be Dermal 500 as your wash. And the other thing that I've got there on the screen is something called Clinisept Prep. Now, Clinisept is something that I use an awful lot of when I'm doing procedures in clinic, whether that's peels or microneedling or all sorts of other things that we do in clinic. But the beauty of this is that it's water-based and it uses a kind of bleachy technology. So when you put it on the skin, it doesn't sting. And because it's watery, it dries with no residue. So you're able to sort of treat those areas, get them clean without causing any pain or discomfort. And then also not making the area too greasy so that you're unable to apply the Optune. So that was a really, really good find when we were trying around a whole load of different products to see what would really be helpful. So that one's brilliant. And I definitely recommend if you are struggling with sores to have a little look at that sort of product. Now, we've also got topical antibiotics. So where possible, we'll always try to manage this with creams rather than reaching for tablet antibiotics. So the type of topical ones that I tend to use, so Bactroban, which is usually an ointment-based cream that we give people to apply up their noses if you're carrying Staphylococcus before an operation. So I don't know if any of you have come across that one before, but it's also really useful for these kind of wounds just to get them healed up. The other one is Fusidin, again, another real favourite of GPs as well. So Fusidin, it's a cream, it's a little bit lighter and easier to apply. And we also use chloramphenicol ointment. Now, chloramphenicol ointment can be bought for conjunctivitis over the counter. So that's one that's really widely available and easy to get hold of if you're having a crisis at home over the weekend or something. So if we move then on to other things that we can use, particularly with those little sore areas, the broken skin areas, sometimes what we need to do is to try to relieve a little bit of pressure. And I think from experience of working with patients using Optune, it's really all about how you're able to rotate the arrays. But I know that some of the latest feedback is that with the size of the arrays, sometimes it's very tricky to even find space when you've got quite a small head. So sometimes that can be a real challenge. Sometimes we can use little pressure dressings, so things which will try to relieve the pressure from the skin, like Duoderm Extra Thin. And another favourite is this kind of spongy dressing called Mepilex Without a Border. And these are things that we use quite a lot of in pressure sores anywhere else in the body as well, just to sort of relieve that little bit of pressure and allow the area of skin to heal. Can I have the next slide, please? And there we go, right. So I think that's kind of it in a nutshell. So do we have any questions at all?
Could I ask Dr. Borysiewicz, could I just, it's Oliver Gillespie here, and you prescribed a lot of the, you prescribed a lot of those creams for me. Is there a, and I often find it with my scalp and stuff, which you've obviously seen, I've got some sores on it, but the Lotriderm, for example, I really find, you know, piling that on and then leaving it for a while. Is there a limit to how much? I mean, I'm just aware that these creams have got steroids in them, so you don't want to overuse them.
So I think that one of the first things I would say is that the way that you're using them when you've got the Optune device, you're only going to be changing the device sort of intermittently. So it's not a product that you're putting on the skin, you know, twice a day, every day with no gaps, if that makes sense. So it's a product that you're putting on the skin, then you're popping the equivalent of a dressing over with the kind of Optune device, and then you've got a break for a few days before you're putting your next application. So what that allows the skin to do, it allows an element of skin recovery. So that kind of intermittent use of creams would definitely be how we would want people to use it, rather than sort of using a steroid every day, day in, day out, even if it's a mild one. Because if you have no time for your skin to recover from those applications, that's where you start running into trouble with skin side effects like skin thinning, blood vessel formation on the surface of the skin. So I think with all of this, it's a balance, isn't it? So try to get away with using as little as possible on the areas you need it. But then by the same token, and certainly what I've experienced with Optune and also with other patients having chemotherapy or, you know, other problems and with their skin, and we have to kind of come up with a practical solution, is that if what we're able to do is allowing you to tolerate using the device, then we've kind of achieved our aim. Okay, so I think it is about keeping the skin comfortable and being able to kind of continue with treatment. That's really what I see as my remit to helping you go through treatment. And I think so long as you're using those creams in a kind of slightly intermittent way, not all the time, so when the skin feels better, you just reach for a little bit of light moisturizer and things like that, then I think that's the way to go.
Okay, thank you. That's helpful. Thank you.
So we've got another question in the audience from Hild. I don't know if I pronounced your name correctly. He's on mute and feel free to ask.
There, you can hear me? Yeah.
Okay,
so yes. I have a question regarding if you were on immunotherapy and taking some steroids, you can only take up to like 2 milligrams of steroids a day and beyond immunotherapy. So I was wondering about these, like the Dactacort and the Lotriderm that both have steroids. Is that something that has to be taken into consideration? I mean, how strong?
So when we're Yeah, so obviously with immunotherapy, what you're trying to do is to kind of wake up the immune system to have a response against cancer cells. And it's kind of been revolutionary for a lot of my patients having, you know, melanoma treatments as well. And it's so nice to see a lot of the immunotherapy treatments now coming through for other indications. It's really, really exciting. The difficulty is that what you're doing with those treatments, you're really kind of taking the brakes off the Ferrari of the immune system. So you want it to run wild and kind of to go and do what it needs to do. So you don't want to scupper that by then having steroids to kind of calm down the immune system. So this is why you're asking that question.
Yes.
Now, when it comes to systemic absorption of, you know, creams through the skin, what we're really interested in, it's really the body surface area to volume ratio. So if you think about a baby, they have a very, very high body surface area to volume. So what that would mean with a baby, if we're giving a baby steroids, even mild ones for like an eczema on their body, they will be absorbing very large quantities compared to their volume. So they would have systemic sort of peaks in what they're using. Now, for an average adult, the body surface area that we would be treating with these steroids would actually be very, very small. So if you're applying to the area of the scalp, even if you were applying to the whole scalp, it's still a small area compared to the rest of the surface of your body and also your volume. So it means that kind of by definition, you're not going to be absorbing very large quantities, so probably not enough to have a kind of impact. And with the type of steroid strengths we're using and with the sort of intermittent approach, I don't think it would necessarily register on your sort of, you know, the equivalent of a systemic dose of steroid, if that makes sense. So that's why in preference, whenever I'm managing any of these sort of toxicities or skin toxicities from immunotherapy, we always try to use topical treatments rather than you know, oral treatments. Obviously sometimes we do need to, but certainly if you can manage with the creams, it's better. And then if we talk about steroid strength, so there's always a kind of ladder approach to that steroid strength. So right down at the bottom of the ladder, you'd have hydrocortisone. So that's something you can buy over the counter. Dactocort as well, you can buy that over the counter. That's kind of right down on the first rung of the ladder. So it's a very, very low strength steroid. You have to remember, though, that by applying the steroid under a dressing, so I keep saying the dressing, but the Optune device, the sticky bits would count as a dressing. It means that you take your steroid from a twice-a-day dose to a once-a-day dose, but that's all you'd be able to get on with the Optune device anyway. So you wouldn't want to be doing a double day dosing if you had like a plaster on top of it, regardless of what steroid you're using. So you just use it once a day. With the next kind of step ups, there are other types of strengths, but just to kind of give you an idea of other names that you might see on the pharmacy shelves. So you've got Umavate, which would be a step up from your hydrocortisone, the next rung up. And then one up from that, you've got your Betnovate. So Betnovate would be what's in the Lotriderm ingredients. So again, it's strong enough to kind of have a good hit, but the idea is that you're using all of these products for the shortest amount of time. So I guess what we try to do as dermatologists, it's to make sure that you're using an appropriate strength. And by appropriate strength, it means basically that I'm going in strong enough so that I know it's going to work quickly, and then you're able to get off that steroid onto your kind of skin support or onto weaker strength things when you need them. That would be the kind of rationale. So I'm not necessarily worried about systemic absorption and any impact on immunotherapy, but you're quite right when it comes to the kind of steroid side effects in the skin. We've just got to make sure that we're using appropriate amounts.
Thank you.
Thank you. I've got time for one question in the room, if there's any questions in the room. Yes, Dr. Williams.
In terms of stuff that's available over the counter,
yeah.
Obviously we can use 1% hydrocortisone and Dactocort. Is there anything like Fusidin H that's available over the counter?
No, so that would be something like chloramphenicol eye ointment. So I know this is like trying to know how you can play the sort of pharmacy system so that you can actually access things, because you're always going to have a problem when you haven't got access to a doctor. That's the issue. So chloramphenicol ointment is a really easy one. It's great for skin as well as eyes, so you're not going to have any problems with it. It's perfect for kind of sores. Dermal 500, which is that kind of antiseptic wash, you can buy that over the counter. And Clinicept spray, you can also buy that over the counter. So all of these things are kind of available to you. Now, one of the things that I just wanted to really, really quickly touch on. So what's made me very excited is that obviously in private practice, I've got access to what we call compounding pharmacists. So in the old days, when we were managing skin conditions, we were able to kind of mix up our own magic ingredients in the strengths that we wanted in the right kind of base cream so that we could get the right sort of absorptions. So potentially what we'll be able to do using this sort of approach is to get a weak enough strength steroid, but something that's still going to be effective. Also have that little bit of the antifungal, but again, not overdoing it, but just having a light touch on it, but putting it into a formulation that would allow you to have a very light product, so very a watery or foamy product, so that it's not leaving a greasy residue on the skin. So I think that's something that I want to obviously work with Matt about in terms of seeing if we can come up with our own formulations of things, just to really try to address some of the problems, because at the moment I feel like we're having to use things that perhaps don't have the right texture, and then we're making compromises on what patients are able to do with their device. So I think there's a lot more that we can do to sort of help you guys out.
I think you didn't see Dr. Williams' face at that moment of time. It was a very, very happy face when you said that. So it was a big grin from the back of the room.
Good, good.
But thank you so much, Dr. Borysiewicz. It was really, really interesting. And I know last year when you did your talk, everyone was dying to hear about it, and we utilize it all the time now. So thank you.
Brilliant. And yeah, if anyone ever needs any help or kind of any hints, I mean, I think the patient forum is amazing. I'm sure that you all share my kind of little pearls and things as well, but I think you guys are all educating each other, which is amazing. So I know that by the time patients come and see me in clinic, they go, oh, well, so-and-so said that this really worked for them, and we've tried that. And it's brilliant to see you all pulling together and kind of helping each other out. So yeah, we'll keep going.
Thank you. So we'll move over to the next session, where quickly I will touch upon practicalities of using Optune, and then we will have another panel discussion where we've got Oliver Gillespie, who will be remotely joining us, and we've got Susan and Martin Jordan and Ron Stewart in the audience here. But just bear with me, we're going to set up the room, and while we are doing that,